Hello everybody. The ethical dilemma I'd like to discuss with you today is an issue that I've come across quite a bit working in the cardiovascular intensive care for many years, and that is a patient's right to die. Particular case I have in mind happened a couple years ago. It was an older gentleman. He was married, had one daughter. He had a history of other illnesses before he came to our unit. He was a diabetic, a COPD, a smoker, just chronic illnesses. Came to our unit because he needed a valve replaced. He needed to have surgery. He was reluctant to have this surgery, but his family kind of talked him into it. They were told by the surgeon that if he did not have the surgery, he would die. So he agreed to the surgery. Later we found out from family reports that he had told family that if things should go wrong, he didn't want to be placed on a ventilator. He just wanted to be allowed to die. Had his surgery in a unit, didn't do too well, couldn't wean him off the ventilator, had a lot of lung problems, fluid overload, pulmonary edema. He eventually kept developing pneumos after pneumo, having to have the VAC procedure and other things, never could wean him off the ventilator. Ended up being trach. One night his wife came out of the room and she was crying. She had told nursing staff that he had mouthed to her that he wanted a divorce because she had did this to him. This meaning all the different surgeries and procedures, I suppose. This patient probably lived another 2 weeks or so, but he ended up dying. And to this day, I still think about that family and how much turmoil they were in, and I wonder, how they're coping now because of how the situation wasn't quite resolved. I guess looking at it, trying to resolve it from the morale theory, you have to massage the dilemma, you have to outline your options, review your criteria, resolve, and then act on it, and then look back on it to see if if it was resolved or if things could have been done differently. The dilemma here is a patient's right to die. On one hand, you want a patient to have their autonomy and, make choices in their lives. But on the other hand, you don't want to do any harm, and you want to do all you can to prolong life or to, enable a patient to have a better quality of life. So that's kind of where you're torn. Options, you could let that patient choose, the right to die and, say, I don't want anything done. This enables the patient to have some dignity, have some power, have some say, have some control, especially in this particular patient who probably felt no control over everything that was happening with his body, but he could control whether he'd be allowed to die. So you can give him that. And then on the other hand, you allow this patient to die. Does it set your hospital or other healthcare workers up for legal ramifications? Does it hurt the family if you don't do everything you can to help the patient live? So you kind of have those options. To resolve it, maybe it was best, or it should have been, ensured that this patient had a living will in place, that it was on file, that it was signed, that it was discussed with family, and set in stone. That way the family wouldn't have to make any choices or feel guilty about any choices they would have to make. It's all there what all the patient wanted. So, he should have had a living will, and that would have resolved things. Basically, I believe the patient has a right to choose. He was sick for a long time. It was his right to choose to die. He might have been at peace with his spirituality. He was ready to go, to whatever he believed he was going to go in the afterlife. He was ready. So I think a patient should have that right to choose. The only thing I see that could have been done differently is having a living will. But we should always ensure and allow the patient to choose what they want. And if they would choose to die peacefully and gracefully and with dignity, then we should allow that. You know, that's part of our nursing duties as well. Thank you.